Italy's coronavirus catastrophe. The death toll is rising at an unprecedented level. The government is taking more drastic measures, but will that reduce the number of people dying? And what lessons can other countries learn from Italy? This is Inside Story. Hello, welcome to the programme. I'm Bernard Smith. Hospitals and morgues overwhelmed, bodies piling up in churches, and just under 800 deaths in one single day. That's the shocking reality in Italy, which has become the epicentre of the coronavirus pandemic and a symbol of the enormous challenges facing Europe's public health systems. The government is struggling to keep up with the spread of the virus. It sent in the army to enforce the lockdown in Lombardy, the northern region at the centre of the outbreak. And it's tightening already strict controls on daily life. Prime Minister Giuseppe Conte has ordered all but the most essential businesses to close until April the 3rd. He's described the situation as Italy's most difficult crisis since the Second World War.
Rallentiamo il motore produttivo del paese.
We are slowing down the productive engine of the country, but we won't stop it. It's not an easy decision, but it is a decision that prepares us to tackle the most severe moment of the contagion. The decision is necessary today in order to contain the spreading of the epidemic as much as possible. The health emergency, as we foresaw, is turning into a full economic emergency, but I want to say to all of you that the state is here and the state is present. The government will take extraordinary measures that will allow us to stand up again and restart as soon as possible. Those sacrifices that today can look like a step backward will allow us tomorrow to run up and to come back soon, into our factories, into our offices, into our squares, into the arms of relatives and friends. We are giving up our most beloved habits because we love Italy, but we don't give up our confidence in the future. United, we will make it.
Let's have a look at how Italy got to where it is now. Its first cases were two visitors from the Chinese city of Wuhan. They were placed in isolation at a hospital in Rome on January the 31st. The next day, Italy became the first European country to block all flights to and from China. But the virus had already spread unnoticed. A man known as Patient 1 with severe flu-like symptoms was only diagnosed on his second visit to hospital. He'd been to dinner parties, played football and gone running with friends. Northern Italy, which was at the centre of the infections, was sealed off. Within a few days, the lockdown was extended to the entire country after a spike in cases and deaths. Let's introduce our panel. From Alzano, Lombardy in northern Italy, Francesca Borri, she's a journalist who lives there. From Milan, Rosella Michu, she's the president of the Italian non-governmental medical organisation Emergency, and from Oxford in the United Kingdom, Dr. Peter Drobak, a physician who's taught global health, social medicine and clinical infectious disease at Harvard Medical School. Welcome to you all. Thanks for joining us. We'll start first of all with you, Peter, from the outside looking in. What is going wrong in Italy? Why is Italy struggling to cope with the number of coronavirus patients?
Well, I think Italy, like so many other countries, was really caught flat-footed by this pandemic and really the speed at which it spreads, and failure to take early aggressive action really put them behind the curve. And it's a cautionary tale for every other country about what happens when one doesn't act quickly and comprehensively enough to contain this. It's now reached the point, of course, where it's really overwhelmed the health system. And unfortunately, mortality rates are much higher than they otherwise would have been because, of course, the health system can't cope.
And Rosella, your organisation operates in Iran, Eritrea, Sudan and Italy, of course. What challenges are your teams on the ground facing in Italy at the moment?
Well, many, because we also have a lot of clinics all around the country, from north to south, and we're trying also to help dealing with this outbreak in Milan region city, and both in terms of response for the vulnerable groups and in terms of supporting public hospitals in the region. So it's the system is definitely overstressed, and it's a huge public health issue, and we really have to take care of everybody. We cannot forget anyone behind. If not, it's going to be even more difficult to contain the disease. That's why we decided to focus initially on the vulnerable groups like homeless people, migrants, unaccompanied minors, because if we must stay home for people who do not have a home or do not have a doctor to call when they feel sick, this is a big issue for themselves and for the community as a whole. So this is the way we are trying to cope with that, and at the same time trying to strengthen our hospitals worldwide in Africa or in Afghanistan, because those health systems are much weaker than ours, and we're absolutely concerned about the way that they can cope with a possible outspread over there.
I'll ask you about that a little later on. But Francesca, you're there. Peter talked about people being caught flat-footed initially, about the government being caught flat-footed. Were people paying enough attention to this where you are? Were they taking it seriously?
No, honestly, no one now is listening to what's going on around this bubble of death, basically. We are just watching the dying to die, and it's like here is like being 2 weeks ahead of the rest of Italy and of Europe. And so basically we ran out of intensive care beds a while ago. Then we ran out of oxygen tanks for the ill who are, attended at home. And now we even ran out of flowers in the cemeteries and nothing. I mean, everyone is at home infected or with a family, around who will be infected soon. And there is nothing to treat them, nothing. You just wait, and if you're lucky, you survive. If you're not, you die. This is Alzano Lombardo now.
Peter, as you hear that, I mean, there's no positive news coming out of that part of Italy. Spain, France, and the UK, have they got this to come? Is there anything they could be learning now from Italy, or has time run out?
Yeah, of course, it's so tragic what's happening in Italy, and it was one of the first places to experience it to this degree. And I think what that really means is that for other countries, there's no excuse to follow the same path. Having said that, I fear that Spain, France, the UK, and other countries are very much headed down that trajectory. And at this point, there's no reason to wait and to not be more aggressive. Here in the UK, there's no discernible strategy anymore. There's a trickle of measures being rolled out every day. What we need to do is act more quickly and comprehensively to scale up testing in isolation where possible, to much more aggressively implement social distancing in places where there's already widespread transmission, like London should be shut down as much as is safe to do. And obviously a lot of investments need to be made in preparing the health system for the surge that is really already starting, but will get worse in the days to come.
And Rosella, I see you nodding away there, but of course, your concentration as well, though, is on some of the most vulnerable in society, the migrants and the homeless, ones who often are at the back of the healthcare queue in the best of times. How is this affecting the most vulnerable people?
Well, as I was saying before, these people lack the minimum standards of hygiene, of medical support. They don't have safe places where to isolate in case they develop the symptoms. So what we are trying to do in Milan with the local health authorities and the municipality is to survey all these facilities where this shelter where these people are staying, and trying to scale up the hygiene level, all the logistics, all the flow of movements of people and also of objects of things, the food distribution, the separation between the beds, and of course, once we identify possible symptoms, we start supporting them from the health point of view with our doctors, with our nurses, and we do the training of all the staff that is working in these reception centers and also of the hosts of the people, trying to educate them. And we've also identified a building with the municipality here in Milan where people with symptoms but not confirmed coronavirus infection can be properly isolated and can do their quarantine there with our staff monitoring their health status. And of course, in case they get worse, we will then have to refer them to hospitals. But in this way, we will try to reduce as much as possible the contagion and also try to have a lower impact on the emergency rooms of the hospitals that are already overwhelmed with patients.
Francesca, in the early days of this, there was mixed messages from Italy's political leaders. Yes, they cancelled flights to and from China at the end of January, but the Prime Minister played it down. When the Italian government decided to really crack down and impose these lockdowns, did people start taking it seriously where you were, or were they confused by the mixed messages, Francesca?
To be honest, I arrived here 17 days ago. So even before the partial lockdown of Italy, you know, because the first lockdown was only for northern Italy. And here, everyone was already respecting, you know, rules. It was already a red zone because it was a matter of survival, but it was already too late. And here, really, all of us, I mean, we wear 2 pairs of gloves, we wear masks, we use, you know, we disinfect really everything every 5 minutes. The point is, when you reach this number of, you know, infected, when you have basically sick everywhere, and everywhere means in every home, when, you know, the disinfectant tap is infected, how do you disinfect your hands? There is no way not to get sick here. And, you know, it's just a matter of being asymptomatic or not. When you reach this level, there is nothing you can do. So honestly, my reporting from here is, you know, is not even for Lombardy anymore. It's for Italy and for Europe. But for us, it's late.
Peter, are the governments in Britain, particularly in France and Spain, paying attention to the sort of thing that Francesca is saying? That there seems to have been a reluctance from some political leaders, particularly in the UK, I've noticed, to make these painful decisions to really put the brakes on a functioning society. Have you seen that, Peter? Have you felt that?
Yes, unfortunately, and really over the last 8 weeks, we could have been doing a lot more in terms of preparation. From what I can understand of the decision-making process here in the UK in recent weeks, there was a lot of concern about whether the public would go along with measures to restrict movements and do the social distancing. And that caused a lot of equivocating and really a bias towards inaction. And that really allowed the virus to spread silently over the last couple of weeks, which puts us in a really difficult situation now. I want to add one more important point that we heard a bit from the other guest around what's happening in Italy right now. And that is, we're starting to see that hospitals themselves are actually becoming little epicenters of transmission, where patients and health workers are getting infected as well. And when that happens, even measures like lockdowns won't necessarily help. This is really important to emphasize how badly we need to make sure our health workers have protective equipment, that we have good protocols in place, and where possible, infected patients are being cared for in different parts of the hospital or even different facilities from other patients.
And Rosella, what, from your experience so far, can you say to other governments who come to you and say, how can we stop it getting as bad as Italy?
Well, I definitely agree with what Peter was saying before. What we are realizing here is that perhaps a difference, like, for example, with the Ebola outbreak, is that here you cannot really consider a hospital Ebola-free or coronavirus-free, because patients can be contagious even when they are asymptomatic. So perhaps you can admit someone for a femur fracture and then you find out that he or she has coronavirus. Therefore, we really need to make sure that the entire system is organized as we are all infected and we can spread the virus. So protection of everybody, of every place, every segment, every department within hospitals must be respected. Movements must be really strictly controlled. The flow of patients, of staff, not only of medical staff, doctors and nurses, but also the cleaner, the supporting staff. Everybody has to be really in this mindset thing that what I have to do is that I have to protect others from myself because I might be contagious. And this could be something that it's not easy to implement because, of course, you have to change completely the mind setting and also sometimes the structure, the physical structure, changing the flows and the path through where people are moving and objects, medical equipment is moving. So it's a complex situation. I don't think that anybody would have been able to be really prepared for such a huge challenge. But this is where we are now, and this is what we are trying to implement in all our projects and in discussing with all the health authorities, hospital staff that we are dealing with.
Peter, the way things are at the moment, do you see what's happening now in Italy playing out the same way in Spain, France, the United Kingdom, and then the United States?
Well, I think it already is. We've seen many, and I've spoken to many colleagues in hospitals in London and Scotland and the US that are reporting that their ICUs are already full, and they're already really preparing for the surge. You know, the 2,400 people that have tragically died in Italy in the last 4 days were infected probably about 2 weeks ago when Italy was in a very similar place to where we are in the UK and other places now. So I think we're headed down that trajectory, quite unfortunately. Of course, it's still not too late to act and flatten the curve and try to save as many lives as possible.
Rosella, of course, your team's working very hard in Italy, but a lot of your work is focused in the developing world. Do you see are you seeing any vulnerabilities to tackling the coronavirus in other countries that you're working in at the moment? Are you worried about other parts of the developing world?
Very much worried, honestly speaking, because we know how weak the health systems in those countries are. And we know that if this has been a tragedy for Europe, for Italy, and we can rely on a very well developed and structured health system. I really don't know what's going to happen if this take this dimension in countries like Sierra Leone, Sudan, or Afghanistan. So we are definitely very much concerned. And this is also why immediately, since 2 weeks ago, we started to share with our colleagues the approach that I was explaining you before. So we started to implement IPC measures in all our facilities, regardless the fact that the country had already or not yet registered a coronavirus positive case, because we wanted to do as much as possible to mitigate the risk of spreading the infections in our facilities and in the communities where we're working.
And Rosella, can I ask, of course, we're hearing in Europe and the US, they're already short of respirators. They're running out of medical equipment, gloves and masks. So that puts the developing world, again, at the back of the queue for those sort of emergency supplies, I guess, that Western countries might once have provided to them.
Yeah, I mean, this is something unprecedented. I think that maybe the only comparison that we can make is with the Spanish flu after World War I. So it's a big challenge for everybody. We try to send enough supplies to the hospital, to the hospitals in the countries where we're working, in order to have a store for approximately 3 months of activities. But we really don't know how this is gonna develop, and it's the shortage of protective material, of medical equipment, of drugs. Now we are also hearing that there is a shortage of specific drugs for intensive care treatment. It's something that should concern us all, I think, very much. So I hope that there will be the possibility worldwide to cope with those emergencies.
Peter, I know you played a key role in transforming Rwanda's health system. And it's a fairly advanced in terms of development in Africa. Could Rwanda cope with a coronavirus outbreak?
Rwanda's done a terrific job thus far, and many other countries in the region have. What's really ironic is that many countries in that part of the world acted quickly and aggressively to try to contain this. They know that complacency kills because they've been living with epidemic infectious diseases for a long time. And so the early measures, I think, have helped to keep the number of cases down in many countries in Africa. The problem is, of course, is that if things do continue to spread in settings where the advanced medical care, for example, ventilators and ICU beds are extremely limited, there's very much a risk that even the best health systems in places like Rwanda, Nigeria, etc., could be overwhelmed.
But in those sorts of countries where you've got people living often in very close quarters, how do you impose the sort of social distancing measures or the extreme lockdowns that you're asking of more developed countries to impose?
One thing that's important to remember is there's a lot that goes in between normal life and a total lockdown. And places like Singapore have showed us that with smart actions early on, you don't necessarily need to go that far. We've seen in Rwanda, for example, things like closing of schools and places of worship, of putting hand washing stations at bus stops so people wash their hands before and after getting on the bus, a number of other things, along with tried and true public health measures, aggressive surveillance, isolation, and contact tracing. And that's what it takes to really keep this under control.
Francesca, we all know now there's going to be many, many weeks, probably many months of significant controls on people's lives. Any sign of fatigue in where you are at the moment? Any sign of people tiring of having these restrictions placed on them?
It's not about the restrictions. It's psychologically, honestly, outside of here, you are speaking of, or you are dealing with the social distance. While here it's a little bit different. The distance is the distance between you and your father or mother or son who is sick at home. So especially for me as a war correspondent, the main difference is, in war, after an airstrikes, you run toward the wounded, the injured, you can try to do something. And here, not only you can't do anything because you don't even have an oxygen tank, but when you have at home someone who suddenly, can't breathe anymore, and this happens several times per day, suddenly, they can't breathe anymore. They have fever and shortness of breath. And you can't do anything. You can't even touch, your father or your mother. They are really dying in front of you and you can't touch them. And psychologically, this is something that is really scarring Alzano and these residents. And so for now, all these issues about the restrictions, everybody's trying to survive also, because when, everybody around you is sick, you really wake up in the morning and the first thing you do, you check, first of all, you check, if you can still breathe smoothly. Then we check our throat. Then we check our ears. It's like you live in fear because you think that all of a sudden, you will have a temperature. You don't think of anything else here.
Well, the very sobering information from northern Italy. I'd like to thank all of our three guests, Francesca Borri, Rosella Micio and Peter Drobak. And I'd like to thank you too for watching. You can see the programme again anytime by visiting our website aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Bernard Smith, and the entire team here in Doha, bye for now.